Welcome to our channel. Today, we're diving deep into the world of medical diagnostics with a comprehensive look at the scleroderma panel test. From understanding its pre-test information to exploring its disease associations and clinical implications, we've got you covered. Let's embark on this enlightening journey together. Pre-test information. Let's start with the basics, shall we? Unlike many medical tests that require elaborate preparations, the scleroderma panel test is refreshingly simple. No special preparation required. Specifications of the test. Now, let's dissect the components of this test. At its core, the scleroderma panel test aims to identify specific antibodies associated with scleroderma, a complex autoimmune condition affecting connective tissues. Disease associations. This test is particularly instrumental in detecting antibodies linked to progressive systemic sclerosis, the most severe form of scleroderma. Specimen used. Wondering what specimen is used for this test? Well, it's typically a blood sample, making the process relatively non-invasive for patients. Components include. Among the key components are the detection of specific antibodies, such as SCL70 and centromer antibodies. Test report time. Fear not. The test report time is usually within a reasonable time frame, ensuring swift diagnosis and treatment initiation. Test information. Now, let's pivot to the crucial test information. Antibody detection. Antibodies to SCL70 are detected in roughly 75% of patients with progressive systemic sclerosis, marking a significant association with this severe form of scleroderma. Implications of antibodies. Patients harboring SCL70 antibodies often present with diffuse cutaneous involvement, heightened frequency of pulmonary fibrosis, and unfortunately, an elevated mortality risk. Centromer antibodies. Conversely, centromer antibodies, while less frequently associated with pulmonary fibrosis and mortality, pose an increased risk for pulmonary hypertension. Detailed disease associations. Let's delve deeper into the clinical implications of these antibody associations. SCL70 antibody. SCL70 antibody positivity is often indicative of a more severe disease phenotype, characterized by extensive skin involvement, internal organ complications, and a poorer prognosis. Centromer antibody. On the contrary, while centromer antibodies may suggest a milder disease course, vigilance is warranted due to the heightened risk of pulmonary hypertension, a potentially life-threatening complication. Test utilization. Now, let's explore how healthcare professionals leverage the scleroderma panel test in clinical practice. Conclusion. In conclusion, the scleroderma panel test emerges as an indispensable tool in the armamentarium of clinicians managing scleroderma. Its ability to elucidate antibody profiles, guide treatment decisions, and predict disease trajectories underscores its paramount importance in the realm of autoimmune diagnostics. Closing. Thank you for joining us on this illuminating exploration of the scleroderma panel test. Remember to hit like, share with friends, and subscribe for more enriching content. Until next time, stay curious and stay healthy.